Nursing as a career goes beyond bedside and clinical work. You can work in many different areas outside of the hospital setting, and some can even be done remotely. With the aid of technology, nurses can communicate with patients and their employers without ever leaving the comfort of their own homes. In this video, I'm going to highlight the most popular non-bedside and remote nursing roles that clinical nurses move into. Hey, I'm Emma, founder of Nurse Fern. In the description for this video, you'll find links to in-depth career guides for each of these roles, a helpful free personality remote nursing quiz, and other resources. So if you're about to hyper-focus, start in the description of this video. I have a quick ask for you. If you like the content that Nurse Fern puts out there, if you could give this video a quick thumbs up, it helps us reach more nurses so we can continue to create more content for you. All right, let's get started. Grab your beverage and hang in there because we have 11 non-bedside nursing jobs to get through. First up is case management. Case managers provide essential education and care coordination for patients with new or ongoing health needs. Case managers are also known as nurse navigators, care managers, or care coordinators. We consider case management to be an extroverted remote nursing position because you're going to be having direct contact with patients. Most of that, if you are working from home, will be telephonically. So you're going to have to be at your desk, on your phone, available to have outbound or inbound calls. Most of these positions are full-time, 40-hour per week positions and will be that 8 hours, 5 days a week. The typical basic requirements for the case management roles are 3 to 5 years of acute care clinical experience. The most common companies that nurses get hired into when they're coming from a bedside clinical nursing background are either at their acute care hospital or another one within their area or in the US, and insurance companies. Remote case management is one of the most common remote nursing positions that nurses get into when they're leaving bedside nursing. Next up, we have remote utilization review and utilization management. A UR or UM nurse evaluates whether medical services are appropriate for a patient's condition or situation. They make decisions using benchmarks and standardized criteria like interqual. Complicated cases may require outreach to physicians or other providers. At Nurse Fern, we consider this an introverted nursing position because you often are lost within your computer looking at guidelines and reviewing medical records. Most UR/UM nurses have very limited phone time. And when they do, it's often with provider offices and their team rather than talking to patients. This role is typically a 40-hour per week, Monday through Friday position. The typical background for a nurse who wants to get into utilization review and management is about 3 to 5 years of strong clinical experience. You really have to dive into the job posting to see if this is acute care, home health, outpatient, and if there's any subspecialties they're really interested in. The most common employers who hire bedside nurses into these positions are acute care hospitals, managed care organizations, and other revenue cycle companies. I will say utilization review and management is one of the most popular roles that nurses tell me they want to get into. Up next, we have nurse health coaching. Nurse coaches use motivational interviewing and scientifically based behavior change strategies to help patients improve their health. Coaching might include conventional treatments like medication teaching and condition-specific education. A nurse coach might also recommend referrals to specialists like addiction counselors or child therapists. Coaching could also include referrals to other modalities like yoga or acupuncture. This is 100% an extroverted nursing position because you are working directly with the patients. Whether this is face-to-face in person or over video conferencing like Zoom or telephonically, you're going to be talking with them directly. You can either be traditionally employed or you can have an independent nursing practice. When you're traditionally employed, you can expect that you'll be working a typical 40-hour work week. If you have your own independent coaching practice, you can set your own hours. It is helpful to have clinical nursing experience before you move into a position with nurse health coaching. This allows nurses to recognize and help patients with different health conditions with greater expertise. This can be anything from helping patients manage chronic conditions to assisting new moms adjusting to the lifestyle of having a baby in their home. Companies that typically employ health coaches include acute care hospitals, employee health systems, insurance companies, and health tech companies. Telephonic Triage. Telephonic Triage nurses assess patient complaints telephonically and connect them with the most appropriate resources available, including doctors, hospitals, or medical equipment vendors. Most triage nurses are trained to follow a standardized protocol like the widely used Schmidt-Thompson telephone triage protocols. Telephonic triage is 100% an extroverted position. You are there to answer the phone calls that come in from patients and help direct them to the appropriate resources. Telephonic triage can be a really flexible career. You'll find that triage companies often offer 4, 8, 10, or even 12-hour shift options. And since they often are 24-hour operations, you can work day shift, mid shift, evening, night shift. Clinical backgrounds that triage nursing job postings usually look for are emergency medicine, urgent care, critical care, pediatrics, home health, hospice, and maternal health. Companies that typically hire nurses from clinical into telephonic triage include insurance companies, provider offices, hospitals, and then there are also specific triage contracting companies. These include companies like exclusively RNs. Data abstraction. The clinical nurse abstractor reviews patient records for information and metrics that suggest trends, identify healthcare gaps, and pinpoint potential quality issues. The goal of data abstraction is to translate patient information into a format that helps healthcare professionals identify trends and make decisions. Data abstraction is often a flexible role like telephonic triage, except we consider it introverted. When you work in data abstraction, you are fully in the medical record looking for information and usually don't have any contact with the outside world, which makes it a perfect option for a nurse that needs flexibility and needs a break from human interaction. So some companies do require full-time hours, and then others will be more on a contracted basis where they may offer a minimum 10-hour work week and you work through tasks as they're assigned to you and when you're available. Oncology is the most popular choice for specialty that's desired because of cancer research. But there are many different data registries and quality programs that span everything from maternal health, cardiovascular, surgery, and even pediatrics. Common employers include hospitals and insurance companies, like most of the roles we're highlighting today, but then there are specific data registry companies like Registry Partners, Concert AI, Qcentric, Seox, and Flatiron. HEDIS. HEDIS stands for Healthcare Effective Data Information Set, and it is a performance improvement tool measuring individual providers, plans, and institutions on a specific set of indicators. HEDIS is a little bit different from other remote nursing roles because it has a specific season. HEDIS work typically occurs from January to May each year, and the hiring for HEDIS starts around September, goes through December for the bulk of it, and you will see sporadic positions throughout the season. So while HEDIS only spans a short number of months in the year, it is typically full-time during that period. Many nurses do work HEDIS every year and then move on to other contracts or take the year off, and the rare few nurses work full-time in HEDIS for companies throughout the year. If you work remotely for HEDIS, it is 100% an introverted role because, like data abstraction, you're just in the medical records looking for that specific information. Many nurses do start their HEDIS career though as a field HEDIS nurse, and that is more extroverted because you're going into provider offices specifically and looking through their medical records. So you are going into an office environment and having contact with real life humans. A strong clinical background with a unique skill of being able to navigate multiple types of medical records is very desirable. Companies who commonly hire nurses into HEDIS roles who don't have experience in it include managed care companies and staffing companies. In 2023, one company who has been hiring multiple nurses without experience is BC Forward, and they do contracting for Elevance Health. Denials and appeals. Denials and appeals is a subspecialty of utilization review and management. A remote clinical appeals nurse, also known as a denials and appeals nurse, helps patients get the care they need by serving as patient advocates when claims or services are denied by insurance. Nurses in this career review rejected medical claims, then they review the medical evidence to understand if the denial was appropriate. If the nurse determines that the patient truly needs the denied care, they make an appeal on the patient's behalf. This is an introverted role where you'll be reviewing the medical record, criteria, the claim, and submitting your response to it. Sometimes it includes talking on the phone with providers and with your team, but most often you are doing the work within your computer. Typical schedule is a full-time 40-hour work week, with some nurses being able to work 4 10-hour shifts. A strong clinical background in acute care, outpatient, home health, or provider offices is often desirable. Most often, nurses who do not have experience in this get hired by acute care hospitals and insurance companies, or even clinics and individual provider practices. Prior auth nurse, or pre-service review. This is another component of utilization review and management. A prior authorization nurse reviews requests for medical treatments, services, or procedures to determine whether they qualify for insurance coverage. The job requires nurses to assess, evaluate, and provide recommendations to help ensure patients receive the services they need. And you guessed it, if a prior auth nurse makes a denial, it might go to the denials and appeals nurse. This is another introverted position where you're going to be within the medical record, the requests, and the criteria to assess whether you are able to approve a procedure or request. This is often a full-time 40-hour per week job as well. At least 1 year of clinical experience and more often 3 to 5 of acute care experience is required for this role. A vast amount of nursing backgrounds is suitable to this, and you will often see basic requirements call for a certain number of years of acute care experience, and then in preferred requirements you might see a specialty called out. Nurses often land positions in prior authorization with acute care hospitals, insurance companies, or provider offices. Next up is one of my personal favorites because it is the role that I had as a remote nurse, and it is clinical documentation integrity. A clinical documentation integrity specialist uses their nursing skills to ensure that medical records provide an accurate and complete account of a patient's health journey. While this position initially evolved to ensure that the medical records included the correct diagnosis codes for reimbursement, it also plays an essential role in patient safety. As medical teams grow and a patient's health status changes, a correct and accurate medical record ensures that the patient's care team has all the information they need to provide high-quality care. CDI is an introverted role. You're going to be in your queue and your patient charts throughout the day, and even when you do send questions off to providers and the care team, it is most often through the computer. CDI is typically a 8-hour Monday through Friday, 40-hour work week. Most often, CDI job postings look for nurses with about 5 years of acute care experience, and they highly value critical care and ER. The most common companies that hire nurses are CDI staffing companies, insurance companies, and acute care hospitals. Freelance nurse writer. I also love this one because I started my entrepreneurial career as a personal finance freelance writer, and now I am lucky enough to be able to employ nurse freelance writers at Nurse Fern. Freelance nurse writers use their advanced knowledge of patient education, disease processes and management, and the healthcare system to produce clear, accurate, and engaging health communications. Nurse writers create content for anything from healthcare blogs, white papers, patient brochures, career guides, like ours on Nurse Fern, to copywriting and pretty much anything that needs to be written for healthcare. Freelance writing is both introverted and extroverted because while you're writing and researching, you're probably not talking to many people. But it does require a large component of marketing yourself and finding publications and places to write for. Most freelance nurse writers either work and have their own practices set up, or they work as subcontractors for writing agencies. Any nursing background can translate to freelance nurse writing. You just need to have a strong background in what you do have and strong writing skills. Companies who hire freelance nurse writers. Most often you will be hired as a contractor for a specific company to write a series of blogs, patient education materials, whatever it is for them. But you will be setting your own hours, your own rates, and doing your own marketing. You may also choose to sign up for a content agency to help you get started with your writing career. There are a host of amazing nurse writing coaches out there who have their own online communities where they help share writing opportunities and guide you in ways to get started on this career path. Legal nurse consulting. Nurses who are legal nurse consultants work with attorneys to review medical records and provide expert opinions for cases. The LNC might provide expert testimony in court or work behind the scenes to produce educational information for the attorney. Or they might write reports for a legal team to help them understand a specific condition or treatment process relevant to a legal situation. We consider LNC to be an extroverted role. There are introverted aspects of it, like report writing and medical review, but it is often overshadowed by the extroverted side, like freelance nurse writing, where you have to make your own connections and find your own clients. As most LNC work is contracted, you get to set your own schedule. No one area or specialty is more important than another in nursing for LNC work. What's really important is that you understand how nurses think, how units and departments are supposed to function, and what a standard quality of care is. You'll find that most nurses aren't employed by companies, although some do work for subcontractors. Most set up their own practices and hit the pavement to build their own client base. Thanks for hanging out. You can hit the easy button and check out the next video in the Nurse Fern queue, or you can dive into all of the linked resources in the description for this video.